A COVID-19 vaccine has arrived in Tennessee, and the U.S. Department of Health and Human Services said it should be available in the Tennessee Valley by Wednesday. Channel 3's Mary Frances Hooch joins us live in the studio with more from Bradley County's mayor about how it will be distributed locally. Mary Frances.
Well, Greg, the target date has always been December 15th, which is tomorrow, and Mayor Gary Davis from Bradley County says it looks to be right on time. Now, hospitals are getting the vaccines first, so we reached out to all the local hospitals, and no one knows exactly when those shipments will arrive. Hospitals will only have a 24-hour notice before that arrival, but all say they have plans in place to distribute them.
Vaccinations begin today, as soon as healthcare workers are ready to start providing them.
Officials from the Department of Defense and Department of Health and Human Services updated the public on the progress of Operation Warp Speed and vaccine distribution as the first doses are being received all over the country Monday.
It was pretty amazing to see that actually occurring only 9 months after we had our first positive case here in Bradley County.
Hamilton County Mayor Jim Coppinger declined to comment on the distribution, but Bradley County Mayor Gary Davis talked to Mix 104.1 about receiving them as early as Tuesday.
For weeks we've been having virtual meetings with both the White House and the State Health Department, and they kept using the date tentatively of December the 15th.
Officials with HHS said there are 636 sites in total that are receiving the vaccinations.
145 sites expected to receive vaccine today, 425 tomorrow, and 66 sites on Wednesday.
Vaccines should be in the Tennessee Valley by Wednesday. It's going to hospitals and nursing homes first. A spokesperson for Park Ridge said, "We expect to receive the first shipment this week. We'll be alerted within 24 hours of it arriving at our facility and plan to begin administering within a week." Erlanger and CHI Memorial have distribution plans in place as well. Officials say states are responsible for their own plans to allocate the vaccine. The CDC distributed another $141 million in funding to states to continue planning efforts for distribution. Operation Warp Speed is taking care of the cost of the vaccines themselves and cost of distributing them.
While healthcare payers are handling administration costs, so no American faces an out-of-pocket expense for this vaccine.
Again, hospitals locally said they will only have 24-hour notice before the vaccines actually arrive. The U.S. Department of Health and Human Services said pending successful authorization of other vaccine options, they have enough vaccines already purchased for every American to have one by July of next year. Live in the studio, Mary Frances Hooch, Channel 3 Eyewitness News.